Official name is Ekaterina Kosyachkova. Yes, Katie.
That's pretty good.
Yeah, but,
I'll
and
take
co-founder with Teresa Tiano of My Gut Feeling. And can you guess how much stomach she has? Now we can listen from her. Yes.
Hi, everyone. Thank you so much to the organizers. Thank you so much to everyone that's here today to come to this patient advocacy session. So important that you're here with us today, learning from us, sharing with us. This is absolutely an amazing event. So, like I said, my name is Ekaterina, and I'm here to present on my experiences with a total gastrectomy, meaning 100% stomach removal. So just a little bit about me. So I was diagnosed with a gastric adenocarcinoma diffuse type, signet ring cell type in 2011. At that time, I was 21 years old. So I had a total gastrectomy. Like I said, 100% of my stomach was removed. I also had chemotherapy and radiation to treat my cancer, which at the time in 2011 was standard of care in North America. So I am the co-founder and vice chair of My Gut Feeling, which is the first Canadian stomach cancer non-profit. And in 2020, I started working as a clinician in medical oncology, specifically treating gastrointestinal cancer, so stomach cancer, at Princess Margaret Cancer Centre in Toronto. So to give you a little bit of a background about myself, so in Canada, stomach cancer is rare, so about 3,000 cases per year, unlike Asia. So we do not have routine screening programs, unlike Asia. And because of this, unfortunately, most of patients, 80% of patients will be diagnosed in later stages when symptoms show up. And unfortunately, at that point in time, surgery is not offered because it's oftentimes too late. So in a way, I was lucky because I did have symptoms of a bleeding ulcer. So at 21 years old, I was studying for my pre-medical exams, and I just kept fainting during exams. I went to the emergency department, and they said, oh, don't worry, you're just stressed, you're 21 years old, you just have heavy menses, which I kept telling them I do not have heavy periods. On the third visit to the emergency department, after fainting multiple times and struggling to get diagnosed, finally, my hemoglobin was 55, and I finally received an endoscopy. So when the endoscopy was completed, the pathology showed that I unfortunately had a bleeding ulcer, which was a result of the gastric adenocarcinoma. The location of my tumor was near my pylorus, and like I mentioned, it was a diffuse pathology, not an intestinal type of pathology. I also had staging CT scans and a diagnostic laparoscopy to make sure that I didn't have any micrometastases. And based on this location and my pathology, my physician, my surgeon, told me that the best chance of survival would be a total gastrectomy, so 100% of my stomach removed. When my stomach was removed, it was done through the Roux-en-Y esophageal reconstruction. And when it came out, I had 1 out of 31 lymph nodes positive, but I was an early stage patient, so stage 1B. Despite this, the MAGIC protocol did suggest that I receive adjuvant chemoradiation, and that's what I had. So logistically, the entire operation took about 8 hours from open and close. I stayed in the hospital for about 10 days total, and I was released from the hospital when I could eat solid foods independently and walk and talk and have good quality of life. I had no complications from my surgery, fortunately, unlike some other patients that have had the total gastrectomy, with minimal blood loss. The first year after surgery, however, was very challenging for me. So I did develop one of the rare complications called strictures or narrowing, just at the site of the surgical connection or an anastomosis. This occurred at the time of the radiation, and this really set me back. So for about 2 weeks, I couldn't eat any solid foods, just liquid meals. My poor mother kept trying to force me food, blending meat and potatoes and trying to get any kind of nutrition in me. So that really caused a lot of weight loss around that time. And then also in the first year, I also developed a bowel obstruction or a blockage. And I still kind of blame myself because at that time, I ate steak. So that happened to me. Fortunately, it was a partial bowel obstruction, and I did not require additional surgery. So like the previous speaker did mention, dumping syndrome was an issue for me. So as we all know, there's two types of dumping syndrome. So the early dumping syndrome that occurs about 10 to 30 minutes into a meal, usually occurring with high volume or sugary meals. So I did suffer from those symptoms, and those symptoms are nausea, vomiting, abdominal pain, cramps. So I would say that originally in the first year, I would have dumping syndrome maybe once a day, if not more. Late dumping syndrome is the other type of dumping syndrome that I did not really have, and that happens about 1 to 3 hours post-meal, and that causes hypoglycemia or low blood sugar. And the symptoms of that are dizziness, fast heart rate, sweating, flushing, and fatigue. So I never really caught that symptom, although it's hard to say because I did have some of those symptoms sometimes. So in the first 2 years, the dumping syndrome was quite severe. After the second year, whether it's because I healed or adapted or modified my diet, it would be something that rarely occurred to me. And I can say that now in 2023, so 12 years after my gastrectomy, this might happen once a year, so very rarely for me. Weight loss was a major issue for me. So you can see the 3 images of myself. So 2011 is the first image, after surgery, and then 2023. So the majority of my weight loss was in the first year. And you can see that I was quite overweight, so 78 kilograms. I lost about 22 kilograms all in total. So that was within the first year. I had a very hard time gaining any weight. But by the second year, things stabilized, and I actually started to gain weight. And then this is me now. So hopefully none of you would ever say that I live without a stomach, because I'm a perfectly healthy and normal weight at this point in time. So diet modification was a major challenge for me. So, we're all used to eating our meat and potatoes 3 meals a day, not really thinking about what we eat, eating quickly, being gluttonous. So the first year I really struggled, hence why I was having so much dumping syndrome. So I had to modify my diet by eating 4 to 6 small meals, high protein meals, slowing down when I was eating, lots of chewing, so much chewing, soft, easy to digest food, avoiding red meat, limiting my liquids with my solids, and then really avoiding certain triggers like spicy food, sweet food, fatty food, dairy. Again, by the second year, whether it's because I healed or adapted, my diet became more closer to baseline. Today I eat normal, so I eat 3 medium to large meals per day. Anyone that ate at the restaurant with me yesterday would never say that I have any problems eating. My preference still remains to eat softer foods like chicken and fish. I still avoid steak because of that traumatic bowel obstruction experience, but I can eat it in small quantities, and I do. I eat and drink at the same time. I drink alcohol. Although I still avoid spicy foods, I can eat sweets, fats, and dairy in moderation. The one thing that I still kind of struggle with, even 12 years later, is micronutrient deficiency. So we all know that there are several nutrients that are absorbed with the help of stomach acid. So iron is a big one for me post-gastrectomy. So I was already anemic at the time of my gastrectomy, and my physician kept pushing oral iron. So oral iron made me feel very unwell. I either had diarrhea or constipation. So I would just not take it and be anemic for many years. So ultimately, I did require IV iron, which really helped me with energy. The other thing I still do is B12 injections. So because I'm a healthcare worker, I do my own B12 injections. That's once per month. And then currently, I don't struggle with this, but calcium and vitamin D are poorly absorbed. So post-gastrectomy, you are more at risk for osteopenia, osteoporosis. So I do take a supplement, vitamin D and calcium, just to make sure. The last one is folate. So this one has never been tested for me, but because it is poorly absorbed, if I were to get pregnant, that would be something that I would take as a supplement as well. So in summary, unlike Asia and North America, we do not regularly screen for stomach cancer. It is diagnosed in later, more advanced stages in North America. I was lucky to have a surgery at stage 1B, total gastrectomy. And this was decided mainly by my surgeon because of the diffuse pathology and the location of my surgery. I could not have a PPG because of this. Although I did have complications, the majority of my complications were in the first 2 years after my surgery. And today I can say that I live a fairly normal, healthy, adventurous life being here in Japan. So thank you so much to everyone. Thank you to all the surgeons here today for listening as well.
Yeah. Thank you, Katie. Yes, now we will invite you to the podium after Mr. Imura's talk. It is my privilege to invite